Welcome to educational video on endodontics. This video is about sinus tracts. After watching this video, you will know what is a sinus tract, how to identify a sinus tract, how to trace a sinus tract, and finally, how to interpret a sinus tract radiograph. So, let's get started. Sinus tracts in the oral cavity are openings on the mucosa most often associated with endodontic problems. A sinus tract is a channel that serves as a pathway for the discharge of pus and other inflammatory exudates from a site of infection. Sinus tracts can appear as a swelling, polyp, pimple-like on the mucosa which may or may not discharge pus. Other times, it can appear rather inconspicuous. Sinus tracts can appear on the buccal, palatal or lingual aspects of the gingiva or oral mucosa. Sinus tracts are often symptom-free or present with tenderness to palpation. Patients may complain of foul taste or odor due to the discharge or drainage of pus. The accumulation of pus in the periapical region can be painful for a patient, and relief of pain occurs when drainage occurs via a sinus tract. Patients have reported that after enduring pain for a period, they experience sudden pain relief when drainage occurs via a sinus tract. In order to identify the origin and pathway of the tract, a radiograph with sinus tract tracing needs to be part of the radiographic examination. This radiograph is often referred to as a sinus tract radiograph or a fistulogram. The most common way to perform a fistulogram is to use a gutta percha point. Choose a standardized gutta percha point of size 25, 30 or 35. Inserting a gutta percha point into a fistula is normally not painful. Anesthesia is rarely necessary, but in some cases, if the patient wishes, feel free to administer an infiltration local anesthesia. Once you have selected the correct size of gutta percha point, carefully insert it into the opening of a sinus tract. Be sure to inform the patient of possible discomfort. Continue to insert the point until you meet resistance. Now, take a periapical radiograph. Here you can see how the inserted gutta percha point leads to a periapical lesion. The small size of the gutta percha point allows it to curl slightly at the end, confirming where the source of the infection is. Here is a sinus tract located on the palate. The periapical radiograph indicates that the source of infection is the palatal root. After taking the radiograph, remove the gutta percha point and discard it. In rare cases, a sinus tract can appear extraoral. A sinus tract that drains extraorally can also be traced with a gutta percha point. Here is an extraoral sinus tract and a fistulogram tracing the source of the infection to the lower left first molar. Why trace a sinus tract? Because the sinus tract may not always appear next to the tooth with the infection. For example, here is a sinus tract adjacent to the first premolar. However, radiographic examination reveals that the second premolar has a periapical lesion. Tracing this sinus tract will show where the endodontic problem lies. The presence of a sinus tract can also pose a diagnostic dilemma. For example, this sinus tract on the palate can have an origin from a number of teeth in this region. A fistulogram will ascertain the source of the infection. There can also be other reasons for the presence of a sinus tract, such as periodontal disease, tumors, osteomyelitis, etc. Sometimes a purulent exudate originating from the root apex may drain along the root surface and exit via the gingival sulcus. This appears clinically as an endodontic pocket. Therefore, a clinical examination should include a thorough assessment for signs of sinus tracts and periodontal probing depth. I hope this has provided you with a clearer understanding of sinus tracts. Thank you for watching this video.